And right now, a lot of the Midwestern states are suffering under what is being called the opioid epidemic. Ohio is one of them. And one problem that I see with how we're going about this is that a lot of the response has been about the drug itself, but not about the drug manufacturers or those who distribute it. That is until at least this report from Ohio GOP Senator Rob Portman. Now, this is very interesting. Apparently, according to an investigative subcommittee chaired by Mr. Portman, they have found that a certain pharmaceutical company ended up raising its price of an overdose reversal drug by more than 600% as a way to capitalize on the opportunity. So this right here is a company saying, oh, we've got a crisis going on here. Well, that's okay. Let's jack up the price of our drugs so we can make money. We will capitalize on this as an opportunity. Fascinating. Now, let me get into some of the details of the report. And actually, it's not fascinating. It's disgusting. Now, the report from Portman's Permanent Subcommittee on Investigations and Actions, who commissioned this report, found that the drug company Kaleo pushed up the price of its naloxone drug, Evzio, and the effect of that, of course, is that it increased costs to taxpayers by more than $142 million in the last 4 years, even though, of course, there were less expensive versions of naloxone that were available at the time. Now, the report says the fact that one company dramatically raised the price of its naloxone drug and cost taxpayers tens of millions of dollars in increased drug costs, all during a national opioid crisis, no less, is simply outrageous. Well, he is absolutely right. This is not the first time that we've seen this. We've seen Martin Shkreli push up the price of Daraprim. We've seen insulin prices. We've seen the price of other drugs continue to rise. And so all of this, of course, is based on wanting to make more money, wanting to be a lot more greedy so they can pad corporate profits. Now, Portman's study continued. He said that his subcommittee will continue its efforts to protect taxpayers from drug manufacturers that are exploiting loopholes in the Medicare and Medicaid system in order to profit from a national opioid crisis. So this is one of the first times we've actually seen a report from the government that goes after the manufacturers, that goes after these big pharmaceutical companies. Now, the report also pointed out how lobbying played a role. The report from Portman's subcommittee said Kaleo raised its prices on the recommendation of a drug industry consultant, Todd Smith, who drastically raised prices at other firms that hired him. The company paid Smith and his partner more than $10.2 million for their work. But of course, they raise their prices, they defraud the taxpayer, or extort the taxpayer for lots more money, for millions more dollars, well then they get a return on investment probably akin to the billions of dollars. So in reality, it's actually really smart from an economic point of view. Nonetheless, it's a terrible thing when it comes to people who need this drug. Now, the distribution model that Smith proposed raised the price of the drug by more than 600% by 2016, from $575 per unit to $3,750 and then to $4,100, the report said, even though the company said its production cost for the drug was about $174 per unit. That is an enormous markup. And of course, that extra money doesn't go to creating new drugs. It goes into the pockets of the executives. Not only that, but they said to make sure that the drug would be covered by government programs like Medicare and Medicaid, the company's sales force focused on making sure doctors' offices signed paperwork that said that FCO was medically necessary. Now, that's problematic because, look, the drug itself, naloxone, is offered by more than just one company. But their specific drug, Evzio, they made these offices, these doctors, sign these things and say, no, You have to have this one. You can't go with a generic. You can't go with that other companies. You only have to go with us. And so if we're the only game in town, well, then you have to pay our exorbitant prices. That's just the way it's supposed to work. Sales of the drug climbed after the price increased. While the company said most of its new model focused on patients covered by commercial health insurance, most of its initial revenues were from Medicare and Medicaid, that is taxpayer money, which paid excess costs of $142 million for the drug, even though less costly medicine were available, according to the report. They also said that Kaleo's more than 600% price increase of Zevzio not only exploits a country in the middle of an opioid crisis, but also American taxpayers who fund government-run healthcare programs designed to be a safety net for our country's elderly and most vulnerable. Now, this is important because, well, a lot of different reasons. For one, pointing out the malfeasance of a giant pharmaceutical corporation. I think it's important because what they're doing is that they're exploiting taxpayer money in order to make a profit, to pad their pockets. And what's more important, well, at least on, I guess, rhetoric grounds or ideological grounds, is that this report's coming from a Republican, Rob Portman. So he also pointed out a couple of solutions or attempted solutions. Now, the report recommends the Center for Medicare and Medicaid Services review its policies to keep drug companies from inappropriately influencing prescribing, and that Congress should mandate a 3-day limit on opioid prescriptions because addiction risks increase with longer use. So, now look, those solutions, for one, yes, we shouldn't let pharmaceutical companies be able to influence prescriptions, of course, right? We should also let them lobby the government. And I think more importantly, we should have a Medicare for all system so that the government actually has the ability to negotiate drug prices directly with the manufacturers and not necessarily with the distributors, etc. You just want them, or we should want them, to be able to have fair pricing and the government to have the ability to negotiate that fair pricing, which they currently don't. And so that's why they're able to get overcharged. So Medicare for all system, single payer, would actually be greatly helpful in this. So you limit their ability, or I should say eliminate their ability to be able to lobby the government and allow the government to negotiate drug prices, and you would solve a couple of these problems. Not only that, but look, there's another part here that I want to address, and that is the idea that we should have a 3-day limit on opioid prescriptions, right? I actually don't agree with that. Here's the thing. This doesn't get brought up enough in the midst of the crisis that is going on right now. And that's the people who take these drugs to manage pain, and they do so responsibly. So I've had viewers reach out and say, well, wait a minute, you know, I have family members, or, you know, I take these medications myself. I'm not addicted. I'm not an addict. It's really when you use it irresponsibly, and we shouldn't get, most importantly, we shouldn't get blamed for what's going on right now, and we shouldn't have access to these medications that do help us function through our daily lives. We shouldn't have our access limited. And so I think, unfortunately, that's what a lot of the policy prescriptions in this area seem to go towards, right? Just limit access to it. Instead, maybe you should go after corrupt doctors that are pushing these drugs on people who don't actually need it, or pharmaceutical companies that give kickbacks to these doctors. Things like that, right, would actually be a lot better than putting arbitrary limits on people who do actually need these drugs and are responsible with them. I mean, not every person who takes them ends up being an addict, right? So I think that there is a big problem with putting those limits in. And so, look, don't punish people who rely on these medications for the sins of those who just want to make money, like this company, and don't give a crap who they actually hurt. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.